I'm Dr. Enoch Choi. I'm over at Palo Alto Medical Foundation. I'm so glad to be able to be here today to share with you how medical care and health provision can spread peace around the world. I'm the medical director of Jordan International Aid. It's a 501c3 nonprofit that has traveled over 1 million miles all over the world, helping in disasters and areas with many indigent people who need medical care. That's my evening job. Full-time, I'm actually at the urgent care at Palo Alto Medical Foundation, and I've been there for the last decade. I'm so glad for their support so that they can help and cover for my shifts and things when I'm away at these mission trips. If you would like to be able to reach me, my email is here, and I believe you'll be able to download these presentations. If you'd like to contact me, please feel free to call me. The practical lessons from disasters is what I'd like to bring to you today. How we can provide care and how you can be part of that in providing in these locations we've helped out in the past. In Katrina, in the San Diego wildfires, last year in Haiti, and this year in Japan. What is common to all these disasters is not just the devastation that happens after a tremendous earthquake, as you've seen just this last month in Japan, or the destruction that you saw in Haiti, but are a number of particular qualities on the ground there in the surrounding disaster areas that I'd like to discuss. When you're there, you'll find that you have lack of resources. What you'll have is what you've brought on your back. So try and picture yourself in the middle of one of these earthquakes and disasters. There's no fuel, there's no electricity. What resources are you going to draw on? There's a lack of trained manpower, so you'll have to make do with the people who you have with you, who are surrounding you, who have survived the shaking and the tumbling and the crushing. There's a failure also, you may be surprised, of large organizations. You'll see through the examples I give that large organizations that have taken most of Americans and money from all over the world will be inefficient in delivering care right away after disasters. What you'll be surprised and relieved at is that there's a concept of mutual aid. People around you will be willing to come to your aid in the unaffected areas surrounding you. And thank goodness for them, because they will be the largest support that you'll find. You'll find that there are many willing volunteers that are willing to take breaks and take vacations to go. It's not just the long-term folks that are down on the ground in these places, but I want to share with you today that even if you have a short time, just a week or more, that's what my friends took. We took our vacations or sabbaticals to go overseas. Our experience with Jordan International Aid is that we've been able to bring hundreds of people around the world, people like you, people like me. I was untrained as a disaster medical worker until I took my first trip. And one wonderful thing is that what's helped us, since we're a small organization, is that social media, many of you may be people on Facebook and on Twitter. You may be surprised that there's so many people that are willing to help, that that's an essential part of us finding resources and finding supporters overseas. 6 years ago, Katrina flooded New Orleans. 1 million people were devastated by having to leave their homes. The St. Bernard Parish was completely flooded. That was my first trip, and I was shocked to find a place that looked like it was after a nuclear disaster. It looked like you drove into the Mojave Desert or something with the mud cracked on the ground and the mud cracked on the walls of the buildings, because the buildings were completely flooded up to their eaves, some over the roofs. It was eerie because you would find no insects, no animals, just silence. It's really strange to find just the wind blowing around. And I was so glad to be able to join Menlo Park Presbyterian Church, a local church where I am, in deploying physicians and nurses and support people like counselors and pastors to help us care for people there. As the first day when they reopened St. Bernard Parish, we were able to go in and help in the largest Walmart parking lot in the world. They took over that, and the FEMA and the insurance companies were there to help people, and we located ourselves there. We actually cared for many more people, even though we were a small group of volunteers that had not been formally trained in disaster medical relief. We were just local physicians that took a week off to get down there. And the reason why, this is one of the first principles I wanted to bring out, is that we were where the people wanted to be. People wanted the survivors, the people who were returning to find the things from their homes, to be able to recover things from their homes. We're coming to this Walmart parking lot. Why? Because FEMA was willing to give them some money, and the insurance companies were located there to give them some money. We were connected with the churches there that were supporting us and hosting us there, and as they finished getting their food in line, we just asked them, do you have any medical needs? Can we help you provide you some free medical care? And almost everyone wanted to have something to discuss with us, a prescription that they needed to fill. That fortunately we could write a prescription and write FEMA at the bottom, and we could go outside of these disaster areas. And just like I said with the idea of mutual aid, outside of these areas, the pharmacies were willing to fill those prescriptions, and they were able to get the care that they needed. One amazing thing was that we found that in that first disaster, oftentimes voice connections were not able to be made yet by our cell phones, but we were able to use our cellular internet connections. Many of you have maybe smartphones or iPhones, and you'll know that you can browse the internet or use Facebook and Twitter. At that time, it was really important for us to have that connection because it was a way for us to stay connected when we couldn't call. It was a way for us to get around because we had maps on our devices that were connected. And they allowed us to connect to the internet and be able to find out prescription records of these patients we were seeing. The government had escaped with the VA's records, some schools from higher levels, trudged through the water and gotten down to Houston, and combined these data, these prescription data, with the prescription records of your insurance companies. As they filled those prescriptions, there were records of it. And I was able to, after I credentialed myself as a disaster relief worker, be able to look up the records of those patients. And when they told me they had a blue pill they wanted for diabetes, a red pill they wanted for hypertension, you know, there's so many different pills. I would be able to look in those records and be able to find out what kind of prescriptions that they needed so that we could be able to connect. And so the data connections, the internet connection was very helpful and important. In San Diego wildfires, we went right away instead of a month after. In that location, we were invited by a Christian Disaster Relief Agency, and we were very sad to find that the location, that the Red Cross was unwilling to let us be in the same space. The churches were not in that area, and so we were in a place closer to the fires, but away from where they were receiving aid. As I mentioned to you just a moment ago about the people getting money from FEMA and from the insurance companies. We were unable to be in that same area, so it was disappointing in that area to have less of an impact because there was less cooperation. And sadly, I actually had smartphones and we had the ability to look up records, but I didn't realize until a friend told me later that the same system that they'd set up for Katrina was available for San Diego. So many times in disasters, your information is incomplete and it hampers you and limits you because you don't know about resources. I later found out about that from a friend who tweeted to me saying, didn't you know there was this same thing that you used in Katrina? You could have used it in San Diego. And unfortunately, we didn't. We found out too late. So that's an example of how you guys can be a part of disasters and relief efforts if you engage in social media and help from where you are. You don't have to leave your seat. In Haiti last year, we were able to go a month after the disaster. It left 2 million people homeless. 1/3 of a million people died. And we were sad to find that late last year, cholera broke out from the Nepalese soldiers that were trying to hold peace with the UN troops. We were able to be there 5 days after, and with a group of over 200 physicians and nurses and supporters, people who are untrained like you. We're able to go over 9 trips following that trip to be able to care for many tens of thousands of patients. We went from tent city to tent city, and these are folks who, again, these are physicians, just friends of mine, who are untrained in disaster medicine, but with the basic tools that the knowledge they have as physicians and nurses, and they were able to help with the knowledge that they have. And they were there because they were willing. It's again, this willingness that you have. If you're willing to engage, if you're willing to be part of it, you guys can be part of it as well. These friends of mine were able to be more effective because we coordinated with local missionaries like Mama Boudreaux, who has been supported by my church for many decades. In 2 of our trips, we went and worked at a location called JPHRO. You may have, I don't know if any of you guys watch Anderson Cooper and 360. If you would have seen him at that location, he was sitting in front of the hill in front of 100,000 survivors that were staying on one hole of a golf course that the American military took over and to set up this hospital that Sean Penn thankfully supported financially. In that location, we found that the level of acuity was actually beyond at which our small team could manage. And so after 2 trips there, one lasting 3 weeks, one lasting a week and a half, we realized that we were not quite the right people to be able to help there. And so we've returned back to helping out in the 10 cities that have sprung up all over the country as they try to steer people out and evict them, sadly, from the places that they're having their tents in Port-au-Prince. Things that were very important for us there were resources that we brought from here, very unique to Silicon Valley. Solar power, we had providers here who built suitcases that transformed the solar power from those panels into electricity that we could use to charge our iPhones, to be able to communicate with each other, to be able to use iChart, which is an electronic medical record product. You may wonder, why in the world were you documenting medical records over there? It was really helpful for us to document at least the diagnoses of the patients, so that at the end of the day, we could think about how can we do tomorrow better. We reviewed that day, we could see what the patients, the kind of conditions we saw, and know what kind of resources we want to bring for the next day and for the next trip. Local providers, you may be really surprised to know there's a place in San Leandro right around the corner, MedShare, that takes about to expire medical supplies. And they take them from groups like my own, Palo Alto Medical Foundation, from UCSF, from Stanford, from all the local hospitals, and they give them to people who are going out to disasters. They give them to the free medical clinics in this area. Some of you, if you don't have health insurance, you may have visited, you may have been able to use some of the supplies from MedShare right around the corner from San Leandro. Also, Blessings International and AmeriCares was ways that we obtained medications either for free because they're about to expire or for very inexpensive things. Other really important things that after the outbreak of cholera was water purification. We brought water purification units. Again, a technology that's local here to Silicon Valley and was supported by folks like the Chamber of Commerce in Palo Alto, the young professionals there raised funds to be able to have us bring them over. And that was such an amazing thing to bring to a community that when we were at Mama Boudreaux's up in Gonaïves, 3 days after we left our last trip, cholera was spread in that area because the young peacekeepers spread the cholera down the arch of the Night River. Unfortunately for the people that we were able to help, they had pure water. I'm running out of time, so I would like to just quickly say that in Japan, things are very different. It's a first world economy, even though they've had they've had 2 million people affected. There's extraordinary needs there. And I wanted to just share that there's, it's a reflection of how unprepared we in the United States right here are. Because if a 9.0 earthquake happened, our buildings would not stand as well as theirs. Hopefully we'd never face a tsunami, a 10-story wall of water rushing at 150 miles an hour against our coast, which would wipe away many of our coastal towns. Hopefully in Southern California, our nuclear reactors would not melt down, as we've just heard this past week, those reactors in Fukushima Daiichi have. If any one of those happened here, we'd be in a lot of trouble. And we can take an example from Japan, and there'll be someone here, Menlo, a little later to speak more to that experience. Just wanted to briefly say that you can't believe the hype. The government has really downplayed the need. You'll hear on the ground, Robin was there, you'll hear about how you can be part of helping there. I'm about to return to go to Japan. We have just completed a shipment. It's getting through customs right now of a shipping container full of supplies. We have almost 46,000 pounds of new Gymboree clothes that they've donated, and we're going up to Tome City, which is where they're evacuating people from the coast now inland because they're worried that another earthquake, which a couple of really large earthquakes have happened since the large one, and a tsunami would wipe away the coast again. So we're going back to try and help. The coordination is quite difficult, and many volunteers, people who are untrained like you, have been a big part of helping us be translators in Japan and coordinate that shipment in. And we're building on that expected success of this shipment once we deliver it in this coming week. We want to send another one. So if you'd like to be a part of a shipment of clothes and supplies to be going to Japan, I'd welcome you to come speak to me. You can email me. You can find us on Facebook. Just do a search on my name. And I'd be so excited to have you as a partner in our spreading peace and greater health around the world. Thank you so much.